extra dose. So if you listen to the podcast, the first question I ask everybody is right now, it's just to get a sense of like where you're at in life and what's sparking you, what makes you like joyful. Like what is it in the morning when you wake up that just makes your heart just sing out loud for the day?
Well, I'd be lying if I said anything other than the cold brew I was recently introduced to, which I think is just the elixir of life. It's made by a place in town called Red Silo Coffee. But I know that's not the answer you're looking for. So I'm going to say, honestly, man, I think my relationships. I have a lot of wonderful, wonderful people in my life that I'm very blessed. Family members, friends, my girlfriend, mentors, and interacting with those people, learning from those people, kind of being sharpened by those people, I think is something that I really look forward to and I really get a lot of value out of.
That's interesting. So first you start with the cold brew, right? So that's the first thing that's really, that gets you going. And then what I heard there, Ty, was like learning from people. So you're on, I'm guessing a part of your journey right now is probably like just sucking it all in and learning from people who have, I don't know, wisdom or people you look up to. Is that right?
Yeah, absolutely. I try to surround myself with people that I find inspiring, people that I think are really sharp and intelligent and considerate. And sometimes people have completely different views than I do. That I think is how you grow and polish your own positions and stances and understandings of things.
Well, I'm learning about energy levels. I'm reading this book by Frederick Dodson, I believe it is. And it's energy levels where like all the way from 0 to 1,000, where 1,000's like nobody on the planet, I think, is at that. I think that's God, right? Himself. And I used to relate to what you're saying is I used to, back in when I cared about money for the most part, like look up to people who are millionaires, right? No matter what, I didn't care about anything else. If they had a business, they were making a lot of money. That's who I looked up to. And I truly have shifted that through like, my life's journey and transformation and through this podcast, shifted it to like what you said is people that are kind, respectable, just kind-hearted, like genuine individuals. And those are the people that I look up to, whether they make millions or not, which is like a total shift. And that sounds kind of where you're at right now. I have a question, and I want to go right into what you do for a living. Okay. You're an upper cervical chiropractor. Is that the right title?
That's exactly right.
Dr. Ty. So as a friend, it's really weird to call you Dr. Ty, by the way.
You can just call me Ty. That's fine.
Just like as I said it coming out of my mouth, I was like, so most people on here, not most people, but I'm assuming there's a good amount of people that don't even know what that is. Because for me, I just learned about it a couple of years ago because my wife started doing it. So can you explain a little bit?
Yeah, absolutely. So upper cervical is a specialty within chiropractic where we focus on the upper cervical spine. Many of us will still analyze and treat the rest of the spine, but our specialty, obviously, and our kind of bread and butter is that very complex and very vulnerable upper cervical area. So the base of the skull, the base of the skull we call occiput, and then the first cervical vertebra is C1, Atlas, same name or same thing. They named it Atlas after the Greek Titan that they thought held up the heavens and earth, which I mentioned because I think it's really cool that thousands of years ago they recognized how important that bone was way before we could study it like we can today. So they gave it a pretty important name. And then the one beneath that is Axis or C2. So the relationship of those three bones is very relevant to us. And why is that? Because the brainstem kind of exits what's called the foramen magnum. It's the whole, I have a model here, how perfect. It's the whole of the base of the brain. And then at about the level of C1, it kind of transitions into the spinal cord. So it's mechanically, it's sort of like a linchpin for the rest of the spine because it's so unique in how it moves. There's no there's no disc at that C1 occiput joint or beneath it. The bones are shaped completely differently. It's just very unique. And then neurologically, obviously, it's a hotspot because of the brainstem. So we see the same spectrum of conditions that might go into any chiropractor, but our specialty is in helping with people who have neurological conditions. So we see a lot of post-concussion syndrome patients, vertigo, dizziness, disequilibrium, kind of balance disorders, migraines, headaches. We see a lot of something called trigeminal neuralgia, some occipital neuralgia, Meniere's, a lot of those things. So it's pretty fun. I mean, even sometimes like tremors, seizures, tics, motor tics.
So let me ask you this then. What would be my first question is when my spouse went to a consultation, she came back and I was just like, okay, so what is trying to say this the right way, you know, like you have a chiropractor, just like I go and they crack me, they feel my spine and they crack. And then, you know, you focus on the neck. So what is like, what's the most, I'm trying to say this without like being rude, I guess.
You just go for it. It's okay.
Like, what is the benefit of going to you rather than a chiropractor? It would be the number one question on people's mind.
Yeah, well, and it's tricky, right? Because do I answer for seeing me and specifically? Do I answer for seeing an upper cervical doctor? And
I want to talk about you specifically because I'm going to get into like your some spiritualness around it and stuff like that. So.
Sure. Well, so I think the strength of what we do. So I have a background in research. I was very, very fortunate to be invited to do some research in labs as an undergraduate student. I got a master's as well where we did some research. And so I think between that and coming from a big medical family, I tend to take what I would consider a more objective and analytical approach to the spine. So we are taking really, really awesome high quality digital x-rays to render like a 3D image of that upper cervical spine and measure how all those bones are positioned relative to each other. And then we use a really, really gentle and precise instrument to make corrections to those areas. I think the instrument lends itself to reproducibility and precision. Well, that analysis lends itself to really honing in on what the issue is, and with the objective nature of this work, where we check our work after care's been administered, then we can actually measure and qualify and quantify the changes we're making. So that's one big difference. A lot of people in healthcare, and especially in chiropractic, don't always do, in my opinion, the best job of measuring their outcomes, and sometimes not really doing a good job of measuring things on the front end. And you might be able to get away with that with a number of patients, but I promise you, if you have a post-concussion patient, those can be very, very fragile neurological systems. And you don't want to go in and just start like cracking away at their spinal willy-nilly. You can kind of, for brevity's sake, we'll say sort of overwhelm their system maybe. And for what it's worth, I think I can say this at this point in my career without dangerous ramifications from school. And this is going to be an unpopular statement if you do have any chiropractors listening. I'm not a fan of the what we'll call traditional adjusting. So some of the twisting and cracking style stuff. In fact, and I'm not, this is not to say that it's anything necessarily people should be fearful of or concerned of. That's kind of for everyone to make their own judgment call on. But I'm sort of morally opposed to it because I do think that it sometimes lacks some of the precision that we would like to achieve when addressing the spine. And I think as a patient, you want your doctor, anyone working on your spine or doing any surgery, you want them to be as precise as reasonably achievable.
Yeah.
So I actually never even learned how to do that twisting and cracking style of adjusting. We learned how to fake that in front of our professors in school. Yeah, a big group of us that were kind of just like, I'm not keen on this. And again, if you have the analysis to accompany that style of adjusting, knock yourself out. That's fine. Yeah. But in school, we weren't really given the option to take these 3-dimensional digital x-rays and then use that as our guide. It was like, hey, just poke around and feel for it, and your completely untrained, unskilled self, and then just have at it. And
interesting.
Yeah.
So you were practicing this on each other. What, you know what makes me think of it, right? So that, first off, I have a question. Have you ever seen somebody come in and got an x-ray and you're like, you're perfect. There's nothing we can do. It's a perfect spine.
One. And it's so funny, a guy, a friend of mine from undergrad, and he was a football player. He was, not someone who you would have guessed would have like a perfectly healthy spine, but he was rock solid. And I later have sort of flipped on that, and I realized, no, actually people with more muscle mass tend to have healthier spines. And interestingly, in my observation, I don't have any studies to prove this, but in my observation, in 100% of my observation, football players, rugby players, and hockey players have better spines than dancers, cheerleaders, gymnasts, ballerinas, across the board. And I think a lot of that has to do with the demands of each sport. Obviously in those contact sports, sure, there's a lot of high impact and collision, but you're often bracing. You're bracing your spine. And that's not to say that you couldn't still injure it. Of course you can, but my suspicion is that has a very protective effect alongside just the muscle mass. Whereas those other sports I mentioned really call for extreme hypermobility a lot of the time. So those athletes, the ballerinas, the dancers, they often have really kind of gnarly hypermobility problems, or I should say maybe instability problems that we see. It's kind of interesting. And that's not, I hope, listeners don't feel panicked if they did one of those things, but
it's just something to be aware of, right? Like to be cautious of and keep on top of if you're into that. I mean, that's an interesting perspective, and coming from somebody who's seen tons of different patients, that's something to be mindful of, right?
Yep.
Do you get work done, by the way? What was wrong with your neck when you first looked? What did you have to do to yours? I'm curious.
Yeah, great question. So I was pretty lucky that I didn't have too bad of a neck. And again, that might have had something to do with all of the lifting I've done my whole life. I think muscle mass is one of the most underrated things. It is talked about way too infrequently in healthcare. And it's probably because it's the hardest thing to sell, right? Because you can't sell a workout like you can sell supplements. You can't sell a lot of these other things that internet marketers like to latch onto. And it's probably the hardest bang for your buck you can achieve, to go do a heavy back squat and deadlifts. It's miserable. It's not fun. It's, nobody wants to do that. It's a lot easier to just pop some supplements in your mouth and think you've invested in your health.
Well, what exercises do you think are like if you had to pick 3 exercises that are most important to, for your spine or for your mobility, what would you choose?
Fantastic question. Probably squats, deadlifts, and lunges, if I were to pick 3.
So I had a personal trainer this morning, and every Wednesday, Friday, I have her, and she's a beast. And she had me lunging. I'm like, how many lunges am I going to do? I had a weight bar, and I'm lunging all the way across the parking lot and back. She's getting me step lunging. I'm stepping up and lunging back on a step. I'm like, geez. So yeah, that's and squatting and.
Yeah. And maybe to guide people, I would say kind of multi-joint, like big compound movements where you're using multiple joints, you're using a lot of muscles. I tend to steer people away from isolation exercises. I think, if you only have so much time in the gym, then spend it doing the things that tax your body the most. To be brief, that's sure. I think a rule of thumb I could encourage.
Sure.
And I sort of digress though, to circle back though, so sort of what got me, and not that you asked what got me into upper cervical, but it's, I think, a relevant journey. So I didn't need a tremendous amount of work initially. And so I was introduced to and practiced a kind of full spine technique in school for 3 years. And in my final year, I was introduced to upper cervical. And while I also didn't have, the magnitude of my misalignment was not severe, I found after getting it corrected that it was having tremendous impacts on my mood. So my major symptoms, I didn't really have much meaningful pain. I didn't really get headaches. I didn't get migraines. I didn't get any of that. I would get super impatient, super short-tempered, just a very different person when I was out. And I never realized that until I got it corrected. And the behavioral and mood changes it made were night and day. So it's one of those things that alongside just seeing this doc that I studied under get tremendous outcomes with a really incredible spectrum of patients. And all of them really feel like he's doing well by them. That was the type of thing you can't really unsee that, right? So you're probably like me. If you were to see that, you wouldn't be able to sleep at night knowing somebody was doing that work, and you chose not to do that work if you saw it as the superior option.
Yeah, that's, you say something really interesting in there, and that if you've almost had like an emotional shift from it instead of just a physical. And it reminds me of like in the spiritual sense, right? You have your mind and your body. And where's that connected? It really is that neck area, right? Like what's the term for that? What's the scientific term where the pathways, you know, the neurological pathways are like crazy back here, like 1,000,000 times a day or something?
Yeah, far more than that. So yeah, we
Well,
call
sorry.
well, I only correct it to instill a sense of wonder in people, because it's really incredible what the body does under normal function. So we call that area like the craniocervical junction, but ultimately I think what you're getting at is a brainstem. And you're right. I never really thought about it that way, as the unification of the mind and the body. I suppose you could describe it that way. That's a cool way to think of it. Yeah. Consciousness is tough though.
It is, right. There's a million different ways we can look at it, but it can be an aspect of it, yeah. Right? And I mean, if there's so many neurological things happening, like just like talking to each other in that area, right, between the brain and the body, there's got to be some sort of you know, I mean, heck, you shifted some emotional states just from taking care of that, right? So there has to be some sort of a aspect to that spiritually, but like that's, you know, so I think that being mindful of that area is probably pretty important for people, and myself, and even my wife. She's like, you should just go and have it x-rayed and looked at, and maybe there is something that can be adjusted that could just, you know, be a little bit better for you. Kind of like you, right? You would never have done it if you didn't know about it.
Yeah, I thought I was getting the best care I could possibly be getting, and I found I was getting great care, but there was something certainly missing from it. And so yeah, I do encourage people to go seek it out if they're curious. I'm not one to try to convince everyone that they have these horrible problems that they need to get fixed. I think that can be very damaging. I really try to empower patients to realize how unbelievably powerful the human body is, and that you know, our goal is to kind of restore things to normal and then let their body take over and try to intervene as little as we can, really.
You know what? You said something else that sparked a little a thought, and you said about focusing more on like how beautiful and how great our body actually is. And I think there's a lot of quote unquote gurus out there, or people that like keep people stuck in a depressing down mindset, because they're so focused on rehashing and digging nonstop over and over and talking about it. I don't know how the best way to explain it, but lately I've been feeling that way about certain individuals that are in the mass media that I won't name. But it gets that feeling when I listen to them again over and over, and I'm like, man, unlike an Oprah, which I love listening to, she's like, keeps me vibrating high.
Right. Well, and I'll say two things. I know you're a big Oprah guy. Everyone knows that.
I listened to her this morning, so that's why it came into my mind.
I love that. All right, so I'll say two things. A friend of mine, who's a physical therapist, friend and mentor of mine, coined this term, quantum diagnosis, right? Wherein he jokes that he's like, if you look for this problem, you will find it. And we see a lot of that going on in healthcare, especially kind of the internet health guru part of healthcare. But I like to point out to people, right? Like we've got this fixation with supplements. Okay. And I kind of, you know, I sort of put my cards on the table earlier. I am pretty cynical on most supplements. And I think that we've sort of convinced people to buy them, again, with the illusion that they're investing in their health. And I think investing in your health takes work, not money. And people don't like that. It's a lot easier to take supplements. But what I like to point out to people, so the traditional like allopathic medicine approach, so this is our kind of mainstream medicine in America. You know, this is going to oversimplify it, and I don't mean there's so many amazing, brilliant things going on in medicine, but at times it can sort of seem like there's a pill for every ill, right? And it's I think it's good that Americans have started to become maybe have I don't know how to say it, but I don't want to say skeptical of medications, but less inclined to just take medications without really feeling like that's what they need to be taking. Does that make sense? Like they, I think Americans are growing increasingly interested in what they can do to avoid taking medicine. Let me say it that way.
A homeopathic type. Hold on. Let me I thought she was out of here. Hold on a second.
Jimmy, this is why I was kicked out. Come here, Jimmy. Jimmy, come here. Come here. Get out.
I'll like for you to check your height. Podcast lifetime, podcast life. So I've had my son come in naked before in the middle of a podcast, unlock the door. It's been good times. So to go back, it's like a you know, would homeopathic be the right word, or holistic approach?
I would have gone with holistic. I'm not necessarily homeopathic, sort of its own animal, but maybe okay. Holistic approach. I think a lot of people are gravitating toward that. Thank you for finding those words. Like
what? Like essential oils, chiropractic work.
Well, to me, like, you know, like I consider kind of a more holistic approach to be exercise, nutrition, managing your stress. A lot of the things I think you advocate for, right?
Yeah.
Sure, chiropractic I would include in that, absolutely. And we're not the only people in healthcare that I think should be included in that. But what I want to point out is that, like, whether you take this pharmaceutical intervention or a supplement intervention, if it's still a pill for every ill, is that really such a holistic approach? You know, like, it's really still allopathy. You're just taking something that isn't regulated by the FDA and probably doesn't have nearly the potential for side effects that some medications have, but like, you're still just popping pills. You know, just because it's some hippie pill doesn't mean that it's, you know, that like this is any more enlightened than the person who's just recklessly and unquestioningly taking pharmaceutical medication, you know? So I think it's interesting that people in the internet marketing health guru space have pulled off this bait and switch without anyone noticing it, right? It's like, oh, this is better because, well, it's not drugs. And it's like, well, okay, sure, it's not drugs. And it's probably 99% of the time less effective than drugs, probably pretty inert most of the time. Yeah. At the doses, a lot of these things are put into supplement form. And people don't really notice that, right? And it makes some sense, though. I know we've kind of harped on it, but it's like, it's easier to take a supplement than it is to change your diet. It's a little bit easier to change your diet than it is to go back squat and deadlift heavy. It's probably even easier to do that than confront your failing relationships and where you need to work on yourself and how you're showing up for your significant others. You know, it's like, a lot of people have been sort of misdirected to look to things that I think are the easy outs that don't produce the results they're actually after. And that's why people shell out just obscene sums of money for these things. And some people are helped by it. I don't mean to completely poo-poo all supplements. I mean, there's definitely some.
Are we talking about like, you're talking about like just a daily multivitamin? I mean, are you talking about magnesium pills, vitamin C? What kind of supplements are we talking about here?
I mean, you name them. There aren't that many that are, and it's tough. Okay. Like, I'm not one to be like, well, if there's no research on something, then it's complete hogwash. No, there's 1,000 reasons why there might not be good research on something yet. People don't understand research, at all. People don't understand the scientific method. They don't understand publications. There's so much more to that than goes into like, whoa, where's a randomized controlled trial for this? It's like, okay, you know, like, so it's not that I write it off for that, but some of these things do have research, and you find, oh, the effective dose is 100 times more than what's in the supplement, you know, and the effective dose had pretty transient effects, you know, so there's a lot of that goes on in the space. And I don't mean to harp on, my bias against supplements this whole time, but it's
so there's better routes in your professional opinion to take, and that's actually putting in the work to make yourself healthier.
What a
right?
crazy novel idea. I'm a heretic for saying these things, but yeah, I who knew, like, worthwhile things take work. We know that in like every other aspect of our life.
And there are like, just for people listening, as like a disclaimer, like, we're not saying, and I know Ty is not saying, there's definitely levels of mental issues and stuff like that where medication is probably most likely necessary.
Oh my God, yeah.
We're not talking about that. We're just talking about like the lower level in general.
Right. Like I have 7 medical doctors in my family, and I think every single one of them would probably say, yes, we are often over medicating, and we are working to improve that. We know there's been an opiate epidemic. We know that we have a big issue with antibiotic overprescription. These aren't my opinions. These are things that get published on. And it's not to say we shouldn't be administering those things, but that we should work to, just work toward better and better practices. And they're trying to do that. So yeah, absolutely. I think, thank goodness we have a lot of the medications we do. Thank goodness we have emergency medicine. But the travesty is that sometimes it's out of the hands of the medical doctor. I'm sure a lot of medical doctors would love for their patients to do everything I just said, but they know that their patients probably won't. And there are certainly instances where if that medical doctor doesn't prescribe a certain drug, that's a liability, they could be penalized for that, right? So this is not at all to demonize medicine. This is not at all to demonize medication. But in any event, I do think people are gravitating toward like, well, I don't want to take medication unless I have to. And I think it's a good place to be, and to say, if I really need to, then I will take it. Or if it's really time sensitive that I take it, then I will take it. And that's a discussion to have with your doctor, your medical doctor. Yeah. I don't prescribe medication, right? So like, I'm not the guy to decide who is appropriate to get what at all. But just that I do think it's good. And you can see it in medicine. I think a lot of medical doctors are moving into more functional based stuff, a lot of nutrition based stuff. And I applaud those that are venturing into that space. That's probably intimidating, and there's a lot of risk. And I think, I do think the health of the country will be better for it if we can kind of move toward that.
Yeah. So there's that aspect. And I want to say this to that, like in relation to this podcast, I preach this, or I talk about this a lot, that, you talk about the people that most people will not actually do the work, right? Because it's true. Like if somebody actually sits there and looks at themselves and says, okay, yes, I'd rather take the pill, right? I was actually texting somebody the other day about meditation. They're like, oh, I'd rather go do psilocybin and it'll fix me for forever, or something like that. They said something ridiculous, right? And I'm like, oh, okay, sure. So, right. So everybody wants that quick, like, right. And doesn't want to put the work in, doesn't want to do 10 minutes a day of meditation. So I always talk about how, like, if we can get our mind a little bit better, whether that's through therapy or meditation or yoga or whatever you want to do, stretching every day, that's going to help motivate you. But like, that's going to help you have a way different type of motivation and intention with your life, where you're going to want to go that other route, where you're putting in a little bit more work for yourself instead of just trying to take the easy route all the time. And then what's it like? It sounds, these your mom and dad doctors, or like, what's it like having all those doctors around you growing up as a person? Was there a lot of pressure? Was there a lot of like, what's it like?
No. Well, fortunately, so my dad is a neonatologist, which is a medical doctor that specializes in essentially helping take care of babies with any sort of birth complications, any birth defects, any high-risk pregnancies. It's really, really awesome work. Yeah, he's the coolest. He literally saves babies' lives for a living.
Kudos to him. Jesus.
Yeah, it really amazing. Amazing guy. Awesome work. And then actually his husband is a family practice doctor. My mom is a nurse, and then there's, radiologists, urologists, surgeons, anesthesiologists, a bunch of them, right? And so I was always in closest proximity to my dad and stepdad, but no, they weren't, there wasn't any pressure. I think my dad was really, really just encouraging of me kind of going into whatever made sense to me.
Did you feel pressure? Like, holy crap, my parents are super smart and intelligent, are doing amazing things. I have to do something. I'm curious.
No, I wouldn't say I felt pressure, but what was really cool is my dad started his practice when I was young. So some of, with one of his best friends who was a neonatologist, and they are on call a lot, right? Like you got to stay at the hospital because people can give birth at any time.
Yeah.
And so he, growing up, I mean, he'd be home. There's a pretty long period of time where he'd be home maybe 2 nights a week. So I would go to the hospital and stay the night with him there, and I'd stay in the on-call room, or I'd sometimes stay in like the hospital beds. I don't know if that's proper, but we got away with it. And
I don't think you could do that anymore.
Yeah, I don't. Yeah. Maybe edit that out in post. I don't want to get him in trouble. But it was some of my earliest memories were of spending time in the nursery at the hospital and seeing him work and be around that setting. So it wasn't that I felt pressure to go into healthcare. It was sort of just that, like, that was what my exposure was, and it was cool to see, one of your idols helping people and helping people's health for a living. So it just sort of gravitated to it, but no pressure, which was cool.
Yeah, that's amazing. Yeah, my neighbor's an anesthesiologist, and I mean, he's just constantly going in and out, like all the time, because he's on call, right? And he's spending nights, and he's talking about his long hours, and it's really taxing, like sleep-wise. I don't know if I'd ever be able to do that myself. Holy cow.
Yeah, no, they've got it rough, a lot of them. It's tough.
So Ty, I didn't even ask you, do you have a meditation practice that you do, like daily or weekly?
I have gone kind of in and out of meditation practices. I think they're really valuable, or they can be. And, different styles of meditation have resonated more with me than others. I don't really have a current one that I'm consistent about. Yeah.
Was there a time in your life where you were pretty consistent with practice?
Yeah. In grad school was probably when I was the most consistent, and it was very helpful in combating some of the challenges I was facing in grad school. But yeah, I was doing it pretty religiously, and it really made a big difference in an otherwise pretty dark time.
I'm curious, do you ever see yourself picking that back up soon?
Certainly. I mean, yeah, it's one of those things, like I said, I think it has varying levels of value depending on where you are in your life. And if and when it feels like that's what I need to be doing, I do make a point to get back into it. Yeah. I think journaling is really an unsung hero that's every bit as therapeutic as meditation. And for some reason, everyone's kind of up meditation's ass and nobody's talking about journaling. And I think it's so valuable. I mean, and there's so many, just like meditation, there's so many different ways you can journal.
Yeah.
Especially a simple one, especially with my patients that are like, I have anxiety, or I sleep poorly. I'll tell them to just do like a bullet list. Cause like if you're writing like long form prose, that can be kind of unapproachable for some people. And people think you have to do like a Dear Diary and write out things that make you sad. And that's not true at all. I'll just do a bullet point list of the things that are on my mind, the things I think I need to do that week, something I feel like I notice I don't have closure on. I'll just get it all down on paper. And then once it's there, you're like, great, okay. Half of these things aren't important at all. The other half I can do later this week, and they're not time sensitive. And that weird stress and pressure and anxiety I had of something looming over my head suddenly seems a lot more approachable and not so daunting.
So getting it out on paper and actually seeing it, there's like that almost release from it.
Yeah. I think, some people get a lot of value in meditation from completely clearing their head.
Yeah.
And I think that is valuable. Sometimes I think it's good to just let your mind race and see where your mind goes and just kind of observe that. And I know a lot of people do endorse that style of meditation. But this is sort of like that version of meditation in journal form for me. So taking it and just brain dumping onto the paper, getting it literally out of my mind, looking at it, and then just kind of, again, realizing, all right, well, none of these things are a tiger trying to maul me right now. So I can go to bed just fine.
Is this like a nightly exercise, morning time mainly? What do you?
Usually I'll do that if I'm feeling a period of like higher anxiety or stress, I'll sometimes do that.
That's interesting. So like a takeaway moment here for people listening is when you're having that like stressful moment or high anxiety, you know, I always talk about doing a couple breaths, right? Some intentional concentrating your breaths, and then, you know, writing it down, writing your feelings down, writing what's going through your mind, and then like getting out that on paper it sounds like a really, really powerful technique. As long as you have that around, even your phone, pull out your phone, right? You can type it in a notepad, same thing, right?
Exactly. Yeah. I've got a note for exactly that. And I'm glad you said breathing too. Obviously breathing frequently a very big part of meditation, but I'll sometimes, if I get into the office in the morning and I'm just like, man, I'm having trouble getting focused for my patients today. Cause you got to emotionally prepare yourself to see patients. You know, it's hard. We love all of our patients, and overwhelmingly they're so awesome and pleasant, but we see a lot of people that are suffering, and it can be emotionally burdensome and taxing to take care of someone suffering, right? Because sometimes it's hard to get their enthusiasm and energy levels and happiness up. And if they come in moping around, it's like, man, that can kind of rub off on you. So you've got to kind of emotionally brace yourself to get ready for patients. And sometimes I'll do like a little Wim Hof breathing session before anyone comes in. And I have been pleasantly surprised by how effectively that seems to kind of snap my mood out of that sort of gloominess and get me.
Give us an example of the Wim Hof breathing that you're talking about.
Well, I do maybe a bastardized version of it, but I'll usually do like three rounds of 10 of those big deep breaths. I'll try to hold, I'll exhale and try to hold for a minute. I don't even get close. I am concerned. My lung capacity as a child, I feel like, was so much better than it is now. I don't know what the deal is. I need to figure that out, but I can hold my breath for like 30 seconds. I'm like, man, yeah. Anyway,
have you ever done it where have you ever done his full breathing method? It's like 10 minutes long, laying down. Have you done that?
I have. I'd be lying if I said I was patient enough for that every time. So I usually do this kind of sort of abridged.
Of course, nobody has a time in between patients for 10 minutes to do this, but
sure.
Like you have, because I did it and I wanted to talk to you about it. I haven't talked to anybody that's actually done it before. So you did the lay down, you breathe in, you hold. So for people listening, it's Wim Hof. You can look him up. But you breathe in, from what I remember, and as much as you can, I mean, you're filling up all the way till you're like, not hurting, but can't do it anymore. And then you hold it, right? And then you breathe it all out, every last piece of breath you can. And then you hold that, right?
Yep. Yeah. I think maybe I'm misremembering. And I think he does it a little bit different in the different videos I've seen, but
okay.
Yeah. I think you take so many big, deep breaths. It's maximal inhalation, maximal exhalation, kind of like really forcing the air in and then kind of letting the elasticity sort of push it out. Exhale, I think you hold the longer period of time on the exhale, and then you hold for a shorter period of time on an inhale, and then you start the cycle over. Yeah.
And then what happened for me, which is really cool. Anybody listening, it's a free video. You can go look it up. It was take 15 minutes and do it. It was pretty nuts. Like I couldn't believe it. Anyway, my whole body started to tingle. Did you get that?
Yeah. Yeah. Oh yeah.
And like crazy. And I was able to hold my breath for like 2.5 minutes on the out breath, because you time it in the video that I watched. Did yours time too?
Yep. Yeah.
Yeah. Do you remember how long you were holding it for?
Absolutely not that long. I don't remember how long. It's certainly not 2.5 minutes. No. But I think like
it sounds ridiculous, but I swear, I promise you, I did it, and I did it a couple times, and I texted my brother or friend John Sager when it happened, and he went and tried it. You know John.
I love John.
And yeah, I texted him, and it was crazy. I was blown away with what happened.
Yeah. Well, I hope your listeners have that experience, not mine, that's really defeating. And you're like, why can't I hold my breath? But in any event, I think what you're after is some level of like induced hypoxia, really, really, really low level hypoxia, I suspect, non-pathological hypoxia, essentially. So I think that's what's responsible for some of the tingling you get. But you should ask a respiratory physiologist for confirmation on that.
Right. It's supposed to be like raising your alkalinity up in your body, right? And getting rid of redoing the air in your body, apparently, or something like that.
That might be how it's described. Some of those, when we get into like alkalinity, acidosis, all those things, I think people overestimate how much you have the ability to change the pH of your blood. A lot of those, and I don't know, I'm getting into nuanced like semantic stuff, but I think sometimes these things are important, right? Because then people are like, yeah, I don't know, sometimes they do an action and they think that there's an outcome that is very different than what's actually taking place. So if you are changing the pH of your blood, it's probably in a very, very transient way. You have incredibly efficient buffer systems that will keep your pH, your blood pH, within a very, very narrow range. But that's not to say, and this is a tricky thing, is then we say, well, does that mean eating alkaline foods is total nonsense? And I'm not the person to answer that, but what I would say is that keep in mind these buffering mechanisms that keep your blood pH in a certain range. Some of them are favorable, some of them are unfavorable, right? If there isn't, my understanding, and this, it's been since my master's that I've had to look at any of this, but if you have a more alkaline load on your body, some of the buffer mechanisms that will keep your pH from getting too alkaline are favorable. Things like depositing certain minerals into your bones, right, and strengthening your bones. Whereas if you have to buffer from an acidic load on the blood, that can leach, I think calcium and phosphorus from the bones. Again, it's been a minute since I've had to look up the specifics, but so people have to understand, like, well, you might not be changing your blood pH. That doesn't mean you're not stimulating some other favorable physiological response. And
right.
Sorry to hunker down on that point.
I know that's I think what I really love about you is how, like, how you take, outside perspective on everything, right? You don't just take it for black and white. Like, okay, let's, and that's super important. That's the gist of, honestly, the being mindful, if we want to use that term again, of your daily life and things you're doing and programs you're taking and supplements you're taking and courses you're taking and chiropractors you're seeing, all this stuff, instead of just like, instead of believing everything you hear and taking it all in, right?
Yeah, I try to be maintain a healthy level of skepticism and be discerning, and I think there's a difference in being a skeptic and being cynical, right? And sure, sometimes I'm cynical, but I try to temper that. But I do think being skeptical is really valuable. And it doesn't mean that you're a naysayer. It doesn't mean you're negative. It doesn't mean you're a hater. It just means you're going to sift through things and ask for a certain level of evidence. And if there's not evidence, then at least some sound physiological rationale for why this thing might be true. I wish that were a more popular stance, but.
Well, I mean, I know what you mean, because when I first was reading to learn, which was not that long ago, I just started, like, I would read, and everything I read, I was like, yeah, like that. And that's what you can find happening to especially new whatever. And then eventually, okay, we needed to start discerning through this and having my own opinions and having my own beliefs and my own, and what I want to take away and what I don't from these readings.
Yeah, absolutely. And it's tough, man. There's a lot of people that make really well thought out, strong physiological cases for things. I'd like to say I'm in that camp, and all of us will be mistaken at times, and that's the thing, is that, like, just understand that sometimes people are painting a really sexy picture of what their thing does, and that might be rooted a little bit more in trying to make a sale than in accurate physiology. But there are obviously a lot of people that are kind of doing their best to work through something. I think chiropractic's in that camp. We don't have nearly the level of research we should have, and that I want us to have, and I wish that were a higher priority for some of the chiropractic schools, but that's why I gravitate toward this work, because it makes the most sound physiological sense to me.
Yeah.
And I think it's pretty defensible, the way we explain what we're thinking takes place and how we're affecting the body.
For people listening, like, what would be like the top 3 reasons or top 5 reasons why somebody should go in to see an upper, you're in Denver, so if there is somebody from Denver listening, go see Ty, but what would be the top 5 reasons to go see, and how do we discern between a good one and a bad one? I don't want to say good and bad. I never like to say good and bad. How do we discern, I don't even know how to say it then.
I know I'll tell you. How do you discern between one I would send a family member to and one I wouldn't send a family member to? How about we'll say that? Yeah. And this is obviously my bias. So by all means, figure out what makes sense and resonates for you. Thankfully, we've got a lot of different flavors of chiropractic, and I promise you there's something for everyone. But I encourage people to look for, now I'll say there's another really cool specialty in chiropractic. I think it's tied with upper cervical for the coolest specialty in chiropractic, and that's functional neurology. I've got a lot of friends that practice that, and they do amazing work. So they also work with a lot of neurological conditions. They do probably even more with post-concussion syndrome, or I should say they see even more post-concussion syndromes patients than we might see. We tend to co-manage those patients spectacularly well together. And they also see a lot of movement disorder patients. So if you have one of those kind of rare neurological disorders, and I shouldn't say rare, but if you have one of those neurological disorders, then some of these rules I'm about to say won't apply if you're seeing a functional neurologist. But I would say if you're after someone who is going to be doing a lot of adjusting of your spine, to me, a non-negotiable would be someone who takes x-rays on the front end, so they have a accurate, objective, measurable criteria to guide what they're going to be doing, and someone who takes post x-rays on the back end and can measure the improvements, the changes that they made based on what they kind of set out to do. So pre and post x-rays to me is very important. Certainly ask the doc, make sure that they adjust in a way that you agree with. Some people love that twisting and cracking style adjusting. Many of our patients specifically didn't want it, so they resonate really well with what we do. I would also find out if that doc will review all of those x-rays with you. If they take post x-rays and they're not willing to show them to you side by side, I would ask why that might be. And maybe trust your intuition on why that might be. But those are kind of my big things. After that, there are different ways to adjust. There are so many different instruments people can use to adjust. They are not created equally. So those are things I would say it's got to make good sense to you, and ask questions. You as a patient deserve to ask questions. You deserve to be educated and feel like you understand what you're making a decision about. Here at Denver Upper Cervical Chiropractic, we're on a mission to have the happiest, healthiest, most well-informed patients in the country. So we spend a lot of time with patient education, probably to the point that some patients are like, I don't really care, or I'm not even following, but I appreciate that you took the time to explain this to me. And I think you have a right to that as a patient. And it's a travesty that so many patients have been led to think their doctor's time is so much more important than theirs. And I mean, there's a limit, right? If someone's, plops down and starts taking over, telling their whole life story when that wasn't what you asked for, then maybe please stop doing that. But
you're referring to a therapist and then come back, right?
Well, and that's obviously always a delicate referral. I love that you had, by the way, really quick sidebar. I love that you had my good friend Sarah Eisenbud on here. She is brilliant. I cannot endorse her enough. I give her card to probably half of my patients. So if anyone listened to that episode, she's truly a magical, wonderful person.
Just a couple episodes back, Sarah Eisenbud. She's I call her my life coach, to be honest. She seriously is. She's amazing.
She is. Yeah.
So,
yeah. Sorry, I digress though.
Yeah. It's funny you said it. So, your neck is doing very well, but I'm not going to show you your after x-rays. They look fine, don't worry. Right. Yeah. Be a little skeptical of that. Yeah.
I think so. I'm probably gonna get hate mail for saying that, but yeah, I mean, it's I don't know. And usually that when I point these things out to people, they're like, yeah, that makes sense. Absolutely. So those are kind of the things I recommend people to look for.
And then what about like issues, like I don't think you said that. Like, what are the top issues that people are having? It's most common that you're like, we can fix that shit. Like, we can take care of that or help you cope with it,
Yeah, absolutely. So I'd say the conditions we see the most success with are probably post-concussion syndrome, Meniere's, migraines / headaches. We definitely see a lot of neck pain. And if we picked a fifth, maybe trigeminal neuralgia. I don't know. And it's not shooting fish in a barrel. We're not batting 1,000, like there's,
right. Say that word again. I got to stop you. No, I don't know what that is. What is it?
Trigeminal neuralgia.
Yeah. What is that?
What I said?
Yeah.
So trigeminal neuralgia is kind of complex condition where the trigeminal nerve, which innervates the face, and it's like sensory innervation of the face. It gets, for brevity's sake, let's say inflamed or irritated in some way.
Okay.
And these poor people get this excruciating, and we're talking like pain that you and I have probably never experienced. Pain that can be so intense that if there's a strong gust of wind, it could drop them to their knees in agonizing pain just from that little stimulation of the wind on their face.
On their face, on a
face.
piece of their face, or the whole?
Yeah. So the trigeminal nerve has like 3 branches: V1, V2, V3, I think they're called. And so it's usually one side of their face. It's not terribly often that it be both sides, and it's not always all 3 zones, but it can be. And it's on their face, and it is absolutely miserable and agonizing. And not everyone has it that severe.
Right.
But that's something that, and not everyone responds. We're not curing these things, right? Like we're treating, or I should say, we are correcting any spinal misalignment and spinal motion issues and restoring some normalcy there. And again, for brevity's sake, we're going to say that alleviates some sort of strain on the nervous system. I kind of hate that I described it that way. I'd really love to dive more into some of the theories on what's going on there. But it
for this audience, we'll just keep it basic.
Yeah, we'll stop there. But it can make a really profound impact on how frequently that flares up, the duration of those flare-ups, or the intensity of those flare-ups. And we do have patients that go 9 months without having an episode or more. And that is something that there's a pharmaceutical intervention for too. And some patients get really good outcomes doing that and seeing us. Some patients are able to get off their medication. Some people need their medication. So it's a mixed bag, and it's a complicated condition, right? We're still learning about pretty much everything in healthcare. So hopefully in 10 years, we'll have better solutions.
Yeah. I've never even heard of it. So that's new news to me. That's tough. That's tough. All right. So what, is there anything that we didn't touch on that, you think that, as a human being, we should be mindful of, whether it has to do with your practice or just in general, one of your favorite topics to talk about, that you're most passionate about? Is there anything that we left out there?
Absolutely. So, I mean, we did talk some about lifting, but, and being active, but I can't stress enough that, like, if you want to talk about the elixir of life or the fountain of youth, it's lifting weights. Muscle mass is one of the most incredibly protective things someone can have. I think people should be spending a lot more time figuring out how to get the most out of their workouts, or just making sure that they're working out, they're being active. A absurdly high percentage of Americans do not hit the minimum requirements for daily activity.
Which would be?
Oh gosh, I don't actually know the guidelines off the top of my head. Sorry, I didn't come prepared with those, but suffice it to say, we are too sedentary as a nation. And that's showing up, and that's kind of an unpopular opinion, taboo thing to talk about, but I think that's showing up with COVID. Like we wonder, why are the Japanese and the South Koreans having so many fewer deaths? Well, their average BMI is like 10 points lower than Americans. It might be close to that. I don't know. It's a little less than that, but it's a significant difference, right? So these are fitter, healthier, leaner people. And I hate that that's getting omitted from the discussion around this pandemic, because I think that that's a travesty. As we work through this pandemic, if we don't start to take some responsibility and hold ourselves accountable and say, okay, what do we need to learn from this? We need a healthier population. We'll have more robust immune systems. We will be able to fight these things if we have a healthier population. Am I saying that this, that healthy people are invulnerable to this? No, I didn't say that, but absolutely, if we were to speak in probabilities, they are certainly less vulnerable to dying from COVID, to a lot of these things. And so I hope that we reflect and say we need to be healthier.
Yeah. That's and that has to do with exercise and food consumption combination, right?
Yeah. And something I point out to people, for hundreds of thousands of years, we had to go hunt for all of our food or gather for all of our food. It was physically laborious. It was taxing. Now we can get all of our food through the window of our car from a clown, right? Like we have removed really, really healthy stressors that shaped our evolution and developed us into who we are. And we have instead inserted them with sitting all day at a desk, you know, with staring down at your phone or your computer screen that's probably too low, and putting ourselves in these really awkward, unnatural, unhealthy positions for super extended periods of time.
Yeah.
And then we're not being active, and we wonder why we're like deteriorating. You know, it's like, well, I think it's kind of clear. I think it seems sort of intuitive.
Ty, one of the coolest things I did, because again, I think I use this term again in this podcast. I think the word mindfulness and mindful gets overused, right? I understand that, but you know, it's true, right? So like being mindful of what you eat, I wrote down, and I never even realized myself. I'm like, oh, I eat pretty healthy, and I like to do like an 80-20 rule, where 80% of my meals I'm consciously choosing like health, and then 20% I'm just going to enjoy my life. Sorry, that's who I am. That's what I'm going to do. Okay, you do you. I'm going to do me. So, you know, and I wrote down what I ate for 5 days straight, like every single thing. As soon as I ate it, I wrote it down. If I had a handful of chips, if I had one cookie, I wrote that down. And seeing it makes you realize, for at least making me realize, how heavy dinners I ate.
Totally.
I'm like, I'm doing pretty good throughout the day, and then I just stuff my face at night until I hate myself. And that's like my routine. And like ever since I wrote that down and saw that, I've lightened up my dinner load. Like I stop myself. I'm more mindful of stopping myself a little bit earlier when I'm actually full. So again, journaling, that's a form of journaling, I guess, right? Like,
yeah, certainly.
And that's interesting.
Well, and I think for how much I rip on like the internet health gurus, I will say one thing that I think I will champion is they are encouraging people to experiment with themselves and to pay closer attention to what's working for them and what feels like it's not working. So I do think those types of things, as long as they don't become stressful for you, are really agreeable actions or procedures to participate in. I think that's good. I see some little feet in the
just oh my God. So this is if anybody's listened to any other episode, about one of every 5 or 6 episodes, one of my kids tries coming in sneakily into the as I'm talking, and I don't know why they like to do it, but it's kind of funny.
And right now, all I can see are little toes sticking out from behind this curtain. It's like a cartoon or something. Like, just I feel like.
Aria. I'll be out in about 10 minutes, okay? Yeah, 10 minutes, okay? Love you.
Thank you, me, my morning hug.
Oh. She asked for a morning hug in case that didn't come through clearly. Well, that's precious.
I'll be behind the curtains.
Okay. Okay. That's Aria. Yeah, she's precious.
She looks so much like Catherine. It's crazy.
Oh my gosh. Yes, she gets that a lot. One other thing to be mindful of that I started doing, I wanted to share along with what you said is, I try to walk for 10 or 15 minutes after a meal now.
Yeah.
Just to let it get the blood flow and burn a few calories after a meal. And that's been very, I don't know, beneficial or something. I don't know. I
totally.
Like
yeah, no, I think that's great.
What are some things you do to keep moving throughout your day? Because obviously you're at an office all day.
Well, I'm on my feet most all of the day. Honestly,
Okay.
I like plop down and sit for a little bit if I get a break between patients. So I kind of have to do the opposite thing to most other people.
Nice.
But yeah, which is, it's great. I like it that way. But yeah, that thankfully the nature of my job, it's pretty physically. It's can be more tiring than you'd think, not just standing all day, but it's physical, moving patients around and doing some of that. So
yeah.
Yeah,
I'd imagine. I had a doctor on here between every patient, he would, he had to open the door. So they waited in the door because it was a primary care physician.
Yep.
And he would take 1 or 2 deep intentional breaths between every single patient all day to kind of reset himself. Like you said earlier, to have that come through with compassion and kindness instead of just thinking of them as a transaction. It helped a lot.
Oh, there's so many good techniques like that.
Yeah.
If you do feel overwhelmed. One I learned from a cool physical therapist. I think she called it the 3-2-1 method. You'd look around and just take note of 3 objects in the room, kind of visually. You'd listen for 2 different sounds, and then you'd kind of take note of 1 thing you can feel. And it's really cool how that just like kind of shifts you away from whatever was like stressing you and kind of regrounds you and keeps you present. So there's a half dozen little things like that I could rattle off, but they're really powerful.
I like that one. That's a really good tip. No one's used that on the podcast yet. That was really good.
It's simple and it's effective. And one other thing, really quick before we wrap up, you asked kind of what are some things I encourage people to maybe focus more on. And I said, exercise, activity levels, lifting weights if you're up for it. But also just like being fulfilled, finding fulfillment. If your work isn't fulfilling, then, I hope your family is, and maybe find hobbies, find some things that you're looking forward to doing during your day. Cause I think that's like it doesn't get talked about a lot, but a lot of people they kind of mope through things and they don't realize that like your like satisfaction and fulfillment comes from accomplishing things, I think, and I don't want to make it so like goal oriented, but it comes from feeling like you have done something. And sometimes doing something could just be showing up and being a wonderful friend for someone. So it's not necessarily that there's some crowning achievement or trophy, but just feeling like, you have some meaningful impact and purpose. I think more people need to strain up stress to focus on those types of things. And even if it's a hobby, I mean, if you pick up carpentry, okay, maybe you made a dresser and you don't feel like you changed the world, but it's still satisfying to be like, I made this, So I wish people would focus more on those things. A lot of times our patients suffer from chronic pain. Frequently I'll kind of get into, well, what do you do? What makes you happy? What are you looking forward to? And they have a really hard time coming up with anything that they're super jazzed up about. And it's like, well, maybe we need to get you active. Maybe we need to get you in some social groups. And a lot of times the more they have to focus on outside of their issues, the more their issues shrink. And it's not at all that they're hiding their issues or suppressing them or crushing them down. It's like, no, you're just not focusing on them constantly. And then your body realizes you don't need to focus on them constantly. And they're not this, death sentence you've convinced yourself they are. And there's more to life than this suffering. So
that's really interesting. That's probably one of the best things you said on the podcast today. I love that. That's one of the best things I've heard in a while. That like, and so I don't know if you said it exactly, and we'll wrap up here in a second. But I don't know if you said it exactly. But were you saying like things we do and that are fulfilling throughout the day can have an impact on how our body reacts?
Yeah, absolutely. I think that's absolutely true. I think there's evidence of that, but even just, like, I mean, so I don't want to, again, I don't want to like poo-poo things like affirmations. And I think if people find affirmations fruitful for them, then by all means lean into that, do affirmations. But if you're like me, where you're like, I don't know that just like saying these things over and over again, I don't feel convinced of those things just having said them. I feel convinced of those things when I've acted in a way that shows those are true. So I would say, again, if you're like me, being a person of action and showing yourself that those things are true is going to take traction with your confidence a lot greater than just looking in the mirror and saying them over and over again,
Yeah. So and I love that, Ty, and that's because that's a personality that you have, right? Where I think there's a lot of different personalities out there where some people, like, by saying things over and over and over, it reminds them more throughout the day to actually take action.
Yeah, certainly.
Like that sometimes that's what is needed for them to actually do something, is that reminder of, oh yeah, look, this is an opportunity for me to give love because I said I am love 100 times this morning. Right.
That's a
Whereas
great point.
normally they wouldn't have even recognized it to begin with. So they don't know where to find it. They don't know where to create it. And that's what the affirmations kind of do for certain people.
You're so right. That's a fantastic point. Yeah. And I certainly don't mean to come across as callous at all toward affirmations.
And you didn't. I was just saying for people that do affirmations, that's huge, because it worked for me a lot. I was just walking around the world completely unaware of like so much shit. And affirmations helped me become more aware of certain things by saying them out loud and actually feeling it.
I like that. Yeah, totally.
So I want to ask you, so I want to take up, I know you have patients and stuff you have to see here. If you could go back, and I ask this question to everybody, if you can go back and tell your 18-year-old self anything, what would you say to them? And
I would probably tell them, like, you are going to confront a lot of people that disagree with you, and you want to check your biases, and you certainly want to reflect on how you come to the conclusions you're coming to, but don't let groupthink, don't let the masses, don't let the opinions of the average person deter you from what you think and know and feel is right in your gut. And I was very, very blessed to have so many incredible mentors in my life that I think showed me that. Thank goodness, but a lot of people don't ever get that. And I'd be lying if I said even with all those mentors, there weren't times where I constantly questioned that. And it's hard, it's you, when you are confident, a lot of people, it can make people uncomfortable. It's weird. I think people tend to dislike the traits in people that they don't have, that they wish they had. And sometimes people that have confidence get ripped down a lot more than people realize. And I think it's a really petty coping mechanism that a lot of humans develop, and it's ugly and nasty, and it's not beneficial to society. And I wonder how many brilliant minds have been just absolutely worked by critics and convinced not to do the things that they were destined to do. And it's, I just tell people, and maybe my 18-year-old self, like, trust yourself, and by all means, again, like, check yourself, but trust yourself.
Love that. And I want to relate to this because I just want to say it. I used to be that way with people who showed me like a lot of love and kindness.
Sure.
I used to be the person that got uncomfortable and the critic to them because I didn't have that, as much of that in me as I probably wanted to or should have, if that makes sense.
Absolutely.
So that I totally can empathize with people who go through that for sure. So thank you, Ty. That was, this was awesome. And I'm curious, is there anything in your life that you like, you seem like the type of person that's very aware of what you're doing every day. And is there anything you got rid of over the past year in your life, or something you added into your life that for a positive?
I don't know if this is, this one, everyone will have to decide if it's right for them, but I'm pretty quick to cut negativity out of my life. I think life is way too short for people, for people that are not improving you or those around you, or are not genuine, authentic agents, or aren't self-aware. I don't, maybe this is my personality type. I'm like an ENTJ. It's called the field marshal. It can be maybe a little bit callous in these ways, but I don't keep negativity in my life if I don't have to. And I think more people should do that and realize, like, there are so many amazing people in this world. Why get hung up on the ones? It's like in chiropractic, we talk about, like, you're in this life raft. Don't chase people swimming away from your life raft. Tons of people are trying to get in the life raft. And I feel that way about the people we include in their life. Like, you don't have to keep negative people to tear you down and keep and hold you back. You don't have to keep them in your life at all. Like, not even a little bit. I don't care about the social faux pas of this, that, or the other on Facebook. Delete your Facebook. Like, no one's probably even going to notice, as sad as that sounds. And I don't say that to be mean. It's like, people are very self-absorbed. Like, focus on your community and spend time with the people that inspire you, that you get something out of, the people that love on you, the people that see the things in you and appreciate the things in you that you want to be appreciated for. Spend your time there, I think. And probably the inclusion in the last, we'll say, couple years would be my girlfriend, who is the most wonderful, authentic, genuine, amazing person. She's the type of person that everyone who meets her likes her, not because she's savvy or smooth. It's because she's so genuine and authentic that it's impossible not to like her. And she's got such a cheerful disposition. She's just incredible. She's an amazing person. She's inspiring. And it's as someone who has a history of sometimes being, again, a sort of cynical, callous asshole at times, she's such an amazing balance that, like, you just look at her and her little smile is like the sweetest thing ever. She's this beautiful Taiwanese girl that's just so precious and adorable. And it's awesome to have a significant other, a partner who genuinely makes you a better person. A lot of people say that. And I hope and think that's probably true for a lot of people, but the degree to which she brings that out of me, I have never had in a relationship, and it's really special.
I love that. I can tell you really, really do love her. That's amazing.
Yeah.
Thanks again, Ty. We'll call it a wrap and press stop here.
Awesome, man. Thanks.